All right, hello. This is Patrick Russell and Kohei Tanaka. Um, we are covering syphilis versus rabies for our presentation. And I'm going to start with syphilis. Syphilis is a bacterial infection. Scientific name is Treponema pallidum. The body systems affected are just about everything, depending on how far along into the infection you or an infected person allows it to get. So it almost always starts off in the integumentary system, specifically the skin, on and around the genitals. This is a sexually transmitted infection, almost always. If left untreated, there is a secondary and tertiary stage, um, during which nervous, cardiovascular, muscle, skeletal, you name it, just about every other system can be affected the longer and longer syphilis goes left untreated. Um, there's a graphic image coming up if you want to cover the right side of your screen, just as a nice little warning. Um, Signs and symptoms. Early symptoms, as I mentioned, include small sores. They're called chancres, which can often go overlooked because they can resemble maybe just a little blister or, um, sometimes don't look like anything at all. So, as I mentioned, secondary syphilis can occur after the first chancres go overlooked, or even after they heal, and just look more like a rash. Um, this can spread out from the trunk of the body all the way out to hands and feet, which will come up in another slide. Um, Symptoms of secondary syphilis can progress from sores into more systemic symptoms like muscle aches and flu-like symptoms. Um, Picture here is of what I assume to be secondary syphilis. It's moved from the genital region, trunk of the body, all the way out to the hands. Um, if this is left untreated, it can go on into a symptom-free latent stage, which can be really dangerous because you might think that you're all healed and you don't have syphilis anymore, when in fact, the infection is kind of just dormant and waiting to move on to this potentially life-threatening tertiary stage, which occurs in 30 to 40% of patients who either choose not to receive further treatment or don't know they need it. So super dangerous if left untreated. Yeah, can affect the brain, nerves, eyes, heart, blood vessels, again, just about everything. So um, into the more microbiology side of things, mode of transmission is almost, yeah, I guess always human to human. The reservoir is humans. Again, as an STI, this is transmitted mostly through sexual contact. Syphilis can be passed from mother to baby, if the mother is positive for syphilis. The populations affected, outside of those congenital cases, the populations are just going to be sexually active individuals. Be pretty tough to contract syphilis or come in contact with the fluid from one of those chancres. It's really just people, I guess, are the populations affected. The geographic distribution is more saturated in areas where access to healthcare and education are not great. There's a map in slide 8 which shows a pretty heavy saturation in the sub-Saharan Africa, um, and it's least prevalent in Central and Eastern European regions. The Virulence factors. T. pallidum is a gram-negative spirochete. I thought this was a really neat picture. You can see the spirals, but if you didn't know what you were looking at, you might say it's kind of pretty. Um, Joke's on you, you know. All right. Means of prevention. Penicillin is the preferred antibiotic. Really, just heavy duty antibiotics are the preferred um, treatment for syphilis. And the means of prevention, if you want to avoid syphilis, sexual abstinence is the only definite way to avoid it. Um, that outside of those congenital cases, there's really not much you can do about who gives birth to you. Safe sex practices, regularly getting tested for STIs and STDs if you're sexually active, limiting your sexual partners and wearing condoms are all ways to reduce your risk. A diagnosis for syphilis requires a positive blood test, which is the most common way of diagnosing. You can also biopsy a chancre and assess the fluid from that, along with cerebrospinal fluid. Public health challenges, I mentioned access to healthcare and education. Um, you can't really treat something that you're not aware of or avoid something you're not aware of. So education's pretty big here. Um, and then of course access to testing and treatment. Can't treat something if you don't have access to the treatment. Um, and then potential solutions are pretty heavily associated with that healthcare and education component. Short of vaccine development, that's kind of the first stand. So here's that map of syphilis incidents around the world. Um, this was from 2021, so pretty recent map. You can see the heavily saturated area in sub-Saharan Africa there. Yep, and then these are various other symptomologies. So this is my fun fact about syphilis, which is kind of a um, there's nothing really fun about it. It's referred to as the great imitator because it can present in so many different ways. So if you get through that primary stage without realizing you've contracted syphilis, these could be some of the first things you notice that make you say, hey, something's wrong here. And so if dry skin or funky teeth are the first thing you notice, syphilis probably isn't the first thing that comes to mind. Um, Mimicking gingivitis or atopical dermatitis or, could be anything. So a lot of folks who are infected with syphilis really don't realize it if they didn't catch it during that primary stage, which makes it so dangerous. Here are my references and my photo references, and I hope I left Kohei enough time. Sorry, Kohei, I ramble.
It's okay.
Here's Kohei for rabies.
Okay, rabies key facts. Rabies virus is transmitted to humans through the rabbit animal saliva. The mortality is mostly 100% once developed. So, immediate post-exposure prophylaxis (PEP) is required to avoid rabies deaths. Next, please. Primarily, rabies affects the central nervous system. The major virulence factors are virus uptake, cell-to-cell spread, the rate of virus replication, and the expression of the rabies virus glycoprotein. Next, please. In the first phase, the rabbit patient may experience fever, loss of appetite, pain, and itching at the bite site. As for acute neurological symptoms, the patient may experience anxiety, hydrophobia, excitability, paralysis, and mental confusion. And eventually, the patient will be in coma and die due to respiratory failure in most cases. Next, please. Rabies is transmitted through direct contact with saliva, tear, and lacrimal secretions or brain or nervous system tissue from a rabbit, animal, or person. In the United States, the most common reservoir species for rabies are bats, skunks, raccoons, and foxes. Next, please. And here is the geographic distribution of the reservoirs of rabies in the United States. Okay, next, please. Globally, it is estimated that rabies causes about 59,000 human deaths per year in more than 150 countries, mainly in Asia and Africa. Next, please. There are some precautions for rabies, such as keeping distance from wildlife and vaccinating pets. As for treatment of rabies, you must wash bites and scratches first and seek medical care for a vaccine as soon as possible. Next, please. Public health challenges for rabies are lack of access to PEP or rabies immunoglobulin due to poverty and wide rabies surveillance. Potential solutions for rabies are pet and wildlife vaccination, sufficient national rabies surveillance, and boosting access to human rabies vaccines globally by public health organizations. Next, please. There are three interesting facts about rabies. First, cats are more susceptible to rabies than dogs. Second, indoor-only pets can get rabies. And third, there is no test for rabies in live animals. So the only way to properly save your pet from rabies is to prevent them from contracting it in the first place by a vaccination. Next, please. And here are all the references for my assignments. Thank you for listening.